Hello, Makua. I just wanted to let you and your family know of what we believe happened to you. And so, what our diagnosis we discovered is that you suffered from a slip capital femoral epiphysis, or SCFE, and it happens, it's an adolescent hip disorder where the femoral head, which is like part of your hip, it moves from the rest of the femur. There's the femur bone, and then there's the head, and it kind of just like slips away. And it's because it happens when that plate between the two, the one that fuses the long part of the bone to the shorter rounded part, it's weak and unable to hold the two together, so it slips. It causes them to like slip apart and slip away. And So it happens during puberty and when a child is growing really quickly, and that's kind of like what's happening to you right now. You clearly had a lot of hormones in your system, and it happened to cause the plate between to broaden, and that causes it to become weaker. Like the two holding together, it becomes weak, and this can cause slippage. But in your case, it just happened to be very weak, and the fall that you endured during your practice happened to just be hard enough to cause them to move, the bone to move, because the growth plate was very weak between the two parts of the bone. And then the treatment that we would suggest for the surgery, we would need to do it very soon, and it would be a surgery where we go in and we put the bone back where it's supposed to be, so the correct positioning. And what we would do is we would put a screw through the long part of the femur, and then the top rounded part, or the femoral head, and the rest of the femur. And this would help to hold them in position so that the growth plate in between fuses them together nice and well, and doesn't make sure we don't have any other slippages or anything like that as you are growing, because that can cause a lot of very awful things, and you won't be able to play sports. And so we need to make sure that stays in place, and that's why we're putting the screw there. So after that, you're going to have to be on crutches for a few weeks, maybe even a few months. We just have to make sure that they heal, everything heals, and then the growth plate is mature enough where it's able to hold the two parts of the bone together to prevent the further slippage. And so that means you won't be able to play your sports for a few months, but honestly, it's the best for you at this moment, because we want to make you happy and healthy again. And so that the only way of doing that is to make sure you have enough time to heal before going back into vigorous activity, because we don't want it to slip again and have you go through it all over again. So I hope we can fix this problem. We're going to fix this problem, I should say that. And I want you to get you back into sports as soon as I can. So let me know if you have any other questions, and we're going to try to make this as easy as possible. All right, thank you.